For more than a century, America's labor movement has fought to make quality, affordable health care a basic right. And I can tell you, we are willing to do it a century more. Because health care is a right, not a privilege. Now think about it. If they do what they're talking about, what happens to 30 million people in this country?
They die.
Die. In Virginia, over 685,000 people are in the Affordable Care Act. What happens to them? And the projection is, if this happens, by 2019, Virginia will have over 1.5 million people without health care. So, but you know what really gripes me, and is a disgrace, is that the ones that are wanting to take away your health care are the ones who don't worry about theirs. That's right. Because as taxpayers, we are the ones that are paying for theirs. So here's a message. When you take away ours, we should take away yours. And Labor will stand with you to protect health care. Labor will fight with you to protect health care. We cannot repeal this unless we have a replacement. And upon closing, let me just say this, and this is not a threat, this is a promise. If taken away, come November, we will remember. Thank you. Now I have, almost forgot, the distinct honor and privilege of introducing to you the newest congressman in D.C., Congressman Donald McEachin.
Privilege of being your congressman. It's because of you that I was able to make as my first speech on the House floor a defense of the Affordable Care Act. And I will say to you what I said on the floor of the House about the hypocrisy that is running through that body right now. Because what they would have you believe is that they base their decisions on Judeo-Christian principles. And if I can just speak from my own tradition just for a moment, my Christ came out of the wilderness, and the first thing he said was, the Spirit of the Lord is upon me to give good news to the poor. And that good news has been health care. That good news has been affordable health care. And for them to seek to appeal it is antithetical to that tradition. Make no mistake about it. My brothers and my sisters, but we will fight. We will fight with every fiber of our being to preserve that health care, because we know that there are more insured Americans today than there have ever been in the history of our country. Every socioeconomic class has benefited from the Affordable Care Act. Premiums have gone down under the Affordable Care Act, contrary to what they would have you believe. So my brothers and my sisters, we need your energy. We thank you for being here today. You are the wind underneath our wings, but don't let it stop today. Call us, write us, send carrier pigeons, smoke signals, whatever you need to do, but stay in touch with us, and not just us, but the other side as well. introduce to you the person I used to call my congressman, but our congressman, Robert Bobby Scott.
Thank you, Don. Give our newest congressman another round of applause. Don McKeithen, Governor McAuliffe, and Tim McCain. Great to join you in this effort. And this isn't just people here in the Richmond area in Virginia. This is going on all over the country. So friends of the Affordable Care Act, we're fighting all over the country. This is Martin Luther King's weekend, and we have to be reminded of the injustice of the health care system that we have now. But before the Affordable Care Act, the costs were going through the roof. Those with pre-existing conditions couldn't get insurance, and if they got it, they'd have to pay a lot more. Women were paying more than men. Millions of people a year were losing their insurance. And then we passed the Affordable Care Act. Costs have gone up, but they've gone up at a lower rate than anything in the last 50 years. Those with pre-existing conditions can get insurance. Women are not paying more than men. Instead of millions of people losing their insurance every year, 20 million more people have insurance than had before. And the Affordable Care Act, the technical name is Patient Protection and Affordable Care Act. Those that have very chronic diseases no longer have annual or lifetime caps. Whatever it costs, they get their coverage. For seniors, we're closing the donut hole, saving an average of $1,000 for every senior trying to buy the prescriptive drugs. For preventive care, the annual checkups, no copay and deductible. Young adults up to 26 can stay on the parents' policies. The Medicare solvency has been extended to the longest time it's been in a long time, well into the next decade. All of that would be lost if we repeal the Affordable Care Act, along with about 50,000 jobs right here in Virginia. We will kill 50,000 jobs if we repeal it, and we'll also lose the 30 million jobs we could get if we ever extend Medicaid to 400,000 working Virginians. And we want to thank our Democrats in the General Assembly and Governor McAuliffe for doing everything they can to try to extend Medicaid. And if you repeal it, the insurance for everybody will be in total chaos. To add insult to injury, if we repeal the Affordable Care Act, we'll actually add to the federal deficit. Now, we have a lot of complaints from the Republicans. Complaint. Now, we solved a lot of problems with the Affordable Care Act, but we didn't solve all of them. And what they're complaining about was there to begin with. The fact that we didn't cure a problem doesn't mean we caused it. And so we need to make sure that when they have complaints, that they come up with a plan to do something about it. They have no plan. They talk about repeal and replace. Well, the only thing guaranteed about repeal and replace is the repeal part. They're going to repeal it. There is no credible reason to believe that they intend to replace. Medicare, when it passed, the majority of the Republicans voted no. Affordable Care Act, all of them voted no. They have voted 60-some times to repeal it, no replacement. If they had a plan, don't you think we would have seen it? How about replace, then repeal? At least you wouldn't have all the chaos, but they do not have a plan. If there is no plan that can insure as many people at as lowest cost as what we did, and if there is a plan, show me the plan. Now, this is not just a traditional political issue. This is life and death. The clerk, right after we passed it, came up to me right after the Affordable Care Act went into effect and said, "Bobby, don't let them repeal Obamacare. My son is alive because of Obamacare." I said, "Well, what do you mean?" He said, late in the year, he was diagnosed with a very serious disease for which there is a cure, but we couldn't afford the treatments. And he was going to die. Thankfully, he lived to January 1st. When Obamacare kicked in, we could afford the treatments, and he's alive today. That's what you That's what this is. This is life or death. So thank you for coming out. We're going to keep Obamacare because you are out here today. Thank you very much.
Ladies and gentlemen, please put a warm Commonwealth of Virginia welcome to Ashley and Zoe Hawkins as she tells you a personal story of her own.
Hi everyone. Thank you all so much for being here to fight for our rights and our health. My name is Ashley Hawkins, and this is Zoe, my daughter. I'm here to talk about the impact the ACA has made on our lives. I'm the founder and executive director of a small nonprofit arts organization, and we work every single day to serve our community. Because of the ACA, I receive a significant subsidy that enables me to cover Zoe, our older son Max, and myself for less than $300 a month. To put this in perspective, without insurance through the ACA, Zoe's recent hospital birth would have been 1/3 of my annual salary. With the ACA, I have the ability to feed and clothe my children and provide them with a warm, safe home. Without insurance through the ACA, I fear that I would not be able to go to work every day and cover the cost of childcare for my children. You're right. The ACA made it possible for me to insure myself and my children and still work in the nonprofit field without fearing that my family's health would suffer because I dedicated myself to public service. The ACA made the future bright and made all the hard work worth it. And now for me and 30 million American citizens, the future is both terrifying and uncertain. Before the ACA, I had a pre-existing condition that made me ineligible for health care. I had pre-cancer, and now I'm wondering if this is taken away, will I be around for my children should that recur? This should not be a partisan issue. Healthcare is a fundamental right. It is security and well-being and self-esteem. Healthcare is the freedom to sleep at night, knowing that no matter what happens, our children are protected. This is why today is so important. We are 30 million Americans who deserve safety, security, and above all, health. We deserve hardworking and ethical representatives like Senator Kaine. We deserve champions like Governor McAuliffe. And thank you all so much for listening to my story and for being here today. I look forward to fighting with each and every one of you on behalf of our security and on behalf of our health care, because it is our right and it is our children's right to be healthy and safe. It is now my great honor and pleasure to introduce a man who has devoted his time in office to creating opportunity for all Virginians. He knows that health care is a fundamental right and an economic necessity. No one has worked harder to expand health care to people who need it. He stood up to the General Assembly and fought hard for Medicaid expansion. Throughout his term, he's expanded services to Virginians with serious mental illness and helped Virginians get coverage through the Affordable Care Act. He is here today as a champion for the health of all Virginians. Ladies and gentlemen, please help me welcome Governor Terry McAuliffe.
Behind you. Designed by Thomas Jefferson in 1785. Thomas Jefferson would be spinning in his grave if he knew we were even having this conversation, the idea that we are going to take health care away from hardworking Americans. It's a disgrace. We can't allow it, and we're going to fight for it, folks. Let me tell you this. We need to do this. As you know, this administration, Ralph and Mark and I, the day we stepped in office, we tried to make lives better for everybody here in Virginia. My first executive order, no discrimination in the state workforce, depending on who, the religion that you follow or whom you love, you are going to be treated the same here in the Commonwealth of Virginia. We banned the box, and I stood in those steps right there, folks. Probably my proudest moment on April 22nd, when I restored the rights of 206,000 felons, more than any governor in the history of the United States of America. People deserve second chances. Second chances matter, and it's about putting your hand out to help folks, and that's why this battle is so important. And I want to first of all say thank you. We love you, and I'm not going to make today political, but let me say this. There are about 2 swing states. Virginia was one of them, and we went blue in 2016. This was Clinton-Kane territory. Why? Because we care about people. We understand the fundamental human rights. Who are we as a nation? Who are we as a Commonwealth? That's why elections do matter. And I thank all of you for the work you've done. We've had a tough battle with this building, as you know. I've worked my heart out to expand Medicaid expansion here in Virginia. 400,000 deserving Virginians whom we have paid for to get health care, they consistently have said, no, we will not do it. I could help 400,000 people who we paid for get health care to help all these families right here in front of me who have no other options. And I say to the legislators, come with me one weekend when we go to the RAM clinic out in Wise County. How many have been out to that RAM clinic? Doctors, nurses, dentists. They go out and volunteer for weekends. Thousands of people come out of the mountains to sign up to get one day of free health care a year. They're Virginians. And about 4 in the morning, they usually hit the limit. 1,000 people are turned away. As I walk around that Wise clinic, I meet these folks. They grab my arm. People say, well, Governor, why are you so passionate? Spend time with these individuals. Say, Governor, if you don't help me, we are going to die. This isn't about a specific piece of legislation. This is about people's lives. And the sad part about that RAM clinic, folks, if you got in your car and you drove 40 miles west, you're in Kentucky. If you drove 40 miles northwest, you're in West Virginia. Both of those states have closed the coverage gap. Are you kidding me? This is the Commonwealth of Virginia. We should lead the nation and not follow. And I say, why do you not? We paid for it. You Virginians should understand, as of right now, standing here today, we have forfeited $7.9 billion. Billion. That's our money. It's gone elsewhere now. We'll never get it back. $7.9 billion to run through our hospitals, to help our nurses, to help our clinics. It's gone forever. This is an important issue. Ralph's a doctor. He deals with these people every single day. He comes in my office. It's another horror story about Virginians. These people deserve the health care. And that's why we're going to continue to fight. And I'm never going to give up, folks. I promise you that as your governor. But let me make the economic argument. Not only health care, we're working hard to build the economy. I'm very proud. As your Democratic governor, with our Democratic Lieutenant Governor, Democratic Attorney General, we took office, unemployment was 5.4. We got it all the way to 3.7, the steepest drop in 32 years. How about them apples? 167,000 new jobs, $14.3 billion affect our economy. You know what affects our economy? What we're doing today, that's what's building the Virginia economy. And if I had that $8 billion, it would even be stronger. So it's an economic argument. We just put $1 billion into education. Largest single investment in Virginia history. Let's build our education. Let's build our workforce. Let's make our citizens healthy. We're on a roll here in Virginia, but the only thing we're missing is this health care piece. And I do want to thank our First Lady, my wife, through her efforts. We were not bringing back federal money to feed our hungry children in our schools. Listen, folks, children are hungry to learn, but they cannot learn if they're just plain hungry. Through Dorothy's efforts last year, 5 million more breakfasts served to our needy children in the Commonwealth of Virginia. So are you ready to fight? So we're going to go to that other white building up there in Washington. And we're going to fight up there. We're going to continue to fight here. What? Yes, let's march up there too. I'm with you. Thank you. Thank you. Yeah, I'm with you all. But let me say this, folks. It's important that we stop this. It's important we grow Virginia. Let me tell you, what's critically important for us is we keep this governor's mansion this coming November and keep it in Democratic hands. Are you kidding me? There is nothing more important. And our Lieutenant Governor and our great Attorney General, let's fire it up. No rest. Are you ready? So I'll fight in this white building. The man who will lead the fight in the other building up there in Washington, our great senator, the greatest vice presidential candidate in American history, the one, the only, Senator Tim Kaine.
Hey, give it up for Terry. Woo! Man, he was emoting so much, I thought he was going to blow the mic out before I got up here, like Gene did earlier. It is so good to be here with Governor McAuliffe, with Bobby Scott, Donald McKeechin, with my great friend Doris Kraus-Mays, our statewide candidates. This is a family, folks. Look around at this family. This is a family from all over Virginia. I've seen people from Richmond, Northern Virginia, Hampton Roads, South Side, everybody coming out today on Martin Luther King's birthday, a day that we advocate for social justice, to say nobody's going to shut us up, nobody's going to turn us around, because we're standing in the breach and battling for tens of millions of Americans. I am glad to be here with my wife, Ann, who is a great battler, a great educator. I am glad to be here with my church choir, the St. Elizabeth's Gospel Choir. And they were sworn to secrecy. They wouldn't tell me this morning they were coming down here to do this, and then they surprised me, which is great. And then just in the visit, so many of you have already come up to me and said, hey, meet my child. This is a child that might not be here if it weren't for the Affordable Care Act. Or can I tell you that I would have had lifetime caps that would have been hit because of the Affordable Care Act? Or I got a pre-existing condition and I couldn't get insurance before, and I can get it now because of President Obama and people who stood up. This is who this crowd is. It's people who understand how important it is. I want to do just a couple of things. I want to tell you a story about something happened this week at 1 a.m. in the morning Thursday. You might not have been up watching. Then I want to tell about this healthcare battle and why it's important to healthcare and the economy, but most importantly, it's something about who we are when we look ourselves in the mirror as individuals and as a nation. And then I want to tell you, to conclude, how we're going to win this thing. Because I don't know all of the twists and turns to this story, and I didn't even know all the steps to the journey we're going to be on, but I'm going to tell you, we are going to win this thing. We're going to win this thing. So here's what happened this week. This week, the Republicans, and I'm not being partisan, I'm just giving you the facts. The Democrats stood rock solid for health care. And it was another party that said, we got to repeal the Affordable Care Act. And they started the process in the Senate. And it was a vote that took place after midnight on Wednesday night, Thursday morning. It was way late so that people wouldn't be in the gallery watching, and not a lot of people would be up watching C-SPAN, but it was the opening vote in the effort to repeal health care. Middle of the night. And we're going to battle now for weeks about this, and that's why we're doing rallies all over the United States, just as you're standing here, so that we can win these battles. But in the middle of the night, when they cast that first vote, the way we vote in the Senate is this. They'll say, okay, the budget reconciliation, it's to repeal the Affordable Care Act. And the polls open for about 15 minutes. You can just walk down to the clerk and say, I vote yes to repeal, or I vote no to kick off this debate. And everybody was anxious to get out of there. So the Republicans all ran up really fast and said yes, and then they all left the chambers. The Dems, we sat in our chairs. We didn't go up and just thumbs up, thumbs down, and leave. No, we all sat in our chairs. And when all the Republicans had voted, when they had all voted, the Democrats one by one, every one of the 48, progressives, blue dogs, east, west, north, south, every one of the 48 stood up and got attention and said something like, on behalf of hundreds of thousands of Virginians, I vote no. I don't think you should steal our health care. I vote no. I don't think health care should just be for the healthy and wealthy. I vote no. And as everybody stood up and voted, the Republican senator who was presiding had a gavel, and he kept banging and saying, you are out of order. There is no debate during voting. You were instructed to sit down. We wouldn't sit down. We wouldn't be quiet. We wouldn't shut up. Because this isn't business as usual. And when I stood up, I said, Madam Clerk, I was sick and you visited me. I vote no. I vote no. Matthew 25. What you do for the least of these, you do for me. And you helped me out. When did we help you out, Lord? When I was sick and you visited me, you were helping me. What you do for the least of these, you do for me. And that's what this is about. Now, we know it's about health care. We know it's about health care. Terry, how many hundreds of thousands in Virginia already through the ACA? Isn't it about 600,000? 650,000 because of the Affordable Care Act have insurance. And families like mine who had it have protection against unfair premiums for women, have protection against getting thrown off because of a pre-existing condition. And another 400,000 could have Medicaid when the state gets around to expanding it. It's about the health care of each of these individuals. The Urban Institute said, if the Republicans repeal the Affordable Care Act, 30 million people in this country will lose health insurance. 30 million people, that's a big number. Sometimes the statistics can blind you to the realities of what they mean. 30 million people is the combined population of 19 states. All of that population will lose health care if these guys take it away with no replacement. And they're saying, no, don't worry, we'll come up with the replacement. You know, we're going to repeal, we'll come up with, why don't we just jump off a cliff and then we'll figure out how to land when we're in midair? That's what they're saying. That's ridiculous. That's ridiculous. And so we've got to stand there and battle for no repeal. And that's what this battle is about. It's going to be tough, as Bobby and Donald know. Very tough in the House, where it's just straight majority rule. Democrats are in a minority. They're all standing strong, but it'll be tough. In the Senate, they give the minority some tools. Filibuster, cloture, some tools where we can shine a spotlight and slow some things down and illuminate what's at stake and try to win some Republican votes. At the end of the day, all we have to have is just 3 Republicans, just 3 out of 52, who will basically say that the needs of 30 million Americans is more important than making some political point to poke President Obama in the eye. We just need 3. That's what this battle is about. Now, it's also about the economy. It's also about the economy. Healthcare is 1/6 of the economy. So if you say, well, we'll repeal and figure it out later, and you just inject a whole lot of uncertainty into the largest sector of the American economy, you think that's not going to have an effect? You think you can just create uncertainty in the biggest part of the American economy, and it's not going to spill over into something else. No. This thing, remember the Republicans said Obamacare will be a job killer. Since Obamacare passed, there have been 15 million new private sector jobs in this country. But if you...
But if you want to see a job killer, then go ahead and repeal something with no plan in place. That's going to kill jobs. What the Republicans do will kill jobs. I'll get the mic back when I can, but I'm going to keep it. But I think the thing that's the most important, even more than health care, even more the economy, this is about who we are. Yes. Who we are as a nation. Who we are as individuals. What do we have, hearts of stone now? No. I see compassionate people everywhere I go. I see people who want to help out their neighbors.
I think we are compassionate people who want to help out our neighbors, not people with hearts of stone in this nation. When I was campaigning for Hillary, I used to always tell a story because I thought it exemplified who she is. And it's a story out of my faith tradition, but it's a story that's well known, and the message is not confined to any tradition. The message is one that is universal. There's somebody beaten up lying at the side of the road. And it's a road that's a busy road, and a lot of people are just walking right on by. Person's beaten up and lying at the side of the road and wants some help. And a whole lot of people just walk on by. People who should know better walk on by. People who are high and mighty walk on by. People with titles walk on by. Religious leaders walk on by. But then in the story, a Samaritan, and in the story, the Samaritan was like a despised minority, offbeat, oppressed, misunderstood, religious minority. A Samaritan is walking by, and he's got somewhere to go too. He had something to do. He was going somewhere. But when he saw somebody lying at the side of the road who needed his help, he just couldn't walk on by. And he was like, I can't walk on by. So he goes over and he offers to help, and he takes the person to an inn. He says, I'm going to make sure you get comforted and you get taken care of till you're ready to roll. Folks, this isn't a story about 2,000 years ago. This is a story about today. This is a story about every day, because there's people on the side of the road who are asking for our help. Some of them have been beat up. Some of them have been bullied. Some of them have been discriminated against. Some of them are lonely and need a friend. Some of them got convicted once and they need a second chance. But millions and millions and millions of them are sick, or they've suffered an injury, or they're healthy, but they wonder what will happen if they get sick tomorrow. They're at the side of the road and they're asking for our help. This is a battle about who we are. And we got a fundamental choice to make. Are we going to just walk on by, or are we going to go over and extend our hand and help? And I'll tell you, the great thing about this story is you don't have to have all the answers. You don't have to have any of the answers. All you have to have, and this is the choice, all you've got to have is this inner motive that says, I'm going to roll up my sleeves and help. I don't know exactly how I can help. I don't really know everything I can do, but I'm going to walk on by. I'm going to walk over. I'm going to roll up my sleeves, and I'm going to help out. That's what this battle is about. And I don't think Virginia or Virginians are people who just walk on by, and I don't think Americans are people who walk on by. I think we are people who want to go over and help out. So this is a look yourself in the mirror and decide what kind of person you are, and what kind of commonwealth we are, and what kind of nation we are battle. Not every battle is like this. Not every battle is so high stakes. Not every battle is so morally just and righteous, but this is one of those battles. And when you have one of those battles before you, we got to do everything we can to make sure we win. Everything. And are we going to win this thing? How are we going to win this thing? Now I'm going to tell you, let me tell you, in one way, we've kind of already won it. Because in this last piece, I want to give us some hope here, folks. And I'm going to tell you, in one way, we've kind of already won this battle. And I'll tell you what I mean by that. The last time Republican president was in the White House for 8 years, they did precisely zero to help anybody get health insurance. The number of uninsured people in the country grew to 45 million. The president was there for 8 years. They didn't do anything to expand health insurance coverage for Americans. Zero. Zero. There is a new Republican president who's going to take office this Friday, and here's what he's saying. Here's what he's saying. Wait, you got to listen to this point. The new president who's taking office is saying, I had Obamacare, but I'll make sure what we do, nobody loses coverage. I'll make sure what we do, nobody pays more. I'll make sure what we do, nobody sees a policy that is of lower quality. He is now saying everything that we just did and saying that he's going to do it. They wouldn't do anything for 8 years, and now they're promising. They've made a promise to their voters and to us that they're not going backwards, they're going forward. Now, you and I both know when they put their plan on the table, if they ever do, and we take a magnifying glass to it, I have grave doubts about whether that was true. But the fact that they've switched from being against expanding coverage to feeling like they have to look voters in the eye and say, no, we believe in coverage, really, we believe it, that says something, which is the power of our advocacy has already won a big battle. We've convinced them that they got to be for coverage, and now we got to hold them accountable to that. We got to hold them accountable. Here's how we're going to win this thing. You can count on every last Democrat, Bobby. All 48 of us in the Senate, Bobby and Donald, every last one in the House stood up against repeal, and they're going to keep standing up against repeal. But to get those last few we need, we got to have you. We've got to have you. Here's one thing you can do that would be so helpful. Share your story about how the Affordable Care Act has affected your family. If you want to share it with my office, I'll get it to all my Senate colleagues. Kane.senate.gov/ACA story. Kane.senate.gov/ACA story. I've had all kinds of folks sending stories in. Families, businesses, doctors, hospitals, sending in stories about how the ACA has helped them, because a story is better than a statistic any day of the week. And the more stories we have to share, the more likely we will win this battle. So that's the first thing you can do. First thing you can do. And then the second thing, as Virginians, reach out to your House members. Reach, especially your Republican House members. You got 2 Democratic senators, and we're on board, Mark and me. Mark's doing an event up in Northern Virginia today. We are on board, and we're going to win this battle with you. But we've got to try to convince some Republican members to sit down at the table. And if they have improvements they want to, hey, I've got some improvements. I think we ought to be able to make prescription drugs cheaper. So I want to sit down. You want to sit down and talk about improvements, then you come sit down with me. But if you're pushing it to repeal, you're going to find an enemy in me, because we can't afford that to happen. But share your story and call your members, your Virginia members. And if you have any ties with Republican senators in other states, maybe your family lives in another state and happens to know somebody, or you've got a tie with somebody, that is so important, because we've got Republican senators coming up to Mark and me on the floor saying, you know, you guys are really right. We really shouldn't repeal this. They are looking for a path. They are looking for a path to join us. And the more they hear from you, and the more the stories are, the more likely we'll win. So I'm just going to conclude, and then we're going to mingle and visit by thanking you all for coming out. Terry, doesn't this make you feel good to see so many great activists here? This is who this great Commonwealth is. We call ourselves a Commonwealth. The wealth we hold in common. It's a community, and that's who we are. And if we act like a community, and fight like a community, and advocate advocate like a community, we will not lose. Thank you guys. Let's go win.
Thank you for coming out to the Fighting for ACA rally. If you will please take any belongings that you brought with you, as this is Commonwealth of Virginia public grounds, any signage, we would greatly appreciate it. Thank you so very much.